Before continuing, I would request you to please subscribe to our channel and press the bell icon so you will never miss any video.
Dengue fever is an illness you can get from the bite of a mosquito carrying one of 4 types of dengue virus DENV. The virus is most commonly found in tropical and subtropical regions, including Central and South America, Africa, parts of Asia and the Pacific Islands. Dengue isn't contagious from person to person except when passed from a pregnant person to their child. Symptoms are usually mild with your first infection, but if you get another infection with a different version of DENV, your risk of severe complications goes up. Symptoms, which usually begin 4 to 6 days after infection and last for up to 10 days, may include sudden, high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, fatigue, nausea, vomiting, skin rash, which appears 2 to 5 days after the onset of fever, mild bleeding such as nosebleed, bleeding gums, or easy bruising. Sometimes, symptoms are mild and can be mistaken for those of the flu or another viral infection. Younger children and people who have never had the infection before tend to have milder cases than older children and adults. However, serious problems can develop. These include dengue hemorrhagic fever, a rare complication characterized by high fever, damage to lymph and blood vessels, bleeding from the nose and gums, enlargement of the liver, and failure of the circulatory system. The symptoms may progress to massive bleeding, shock, and death. This is called dengue shock syndrome (DSS). People with weakened immune systems as well as those with a second or subsequent dengue infection are believed to be at greater risk for developing dengue hemorrhagic fever. There is no specific medicine to treat dengue infection. If you think you may have dengue fever, you should use pain relievers with acetaminophen and avoid medicines with aspirin, which could worsen bleeding. You should also rest, drink plenty of fluids, and see your doctor. If you start to feel worse in the first 24 hours after your fever goes down, you should get to a hospital immediately to be checked for complications. The best way to prevent the disease is to prevent bites by infected mosquitoes, particularly if you are living in or traveling to a tropical area. This involves protecting yourself and making efforts to keep the mosquito population down. In 2019, the FDA approved a vaccine called Dengvaxia to help prevent the disease from occurring in adolescents aged 9 to 16 who have already been infected by dengue. But, there currently is no vaccine to prevent the general population from contracting it. To protect yourself, use mosquito repellents, even indoors. When outdoors, wear long-sleeved shirts and long pants tucked into socks. When indoors, use air conditioning if available. Make sure window and door screens are secure and free of holes. If sleeping areas are not screened or air-conditioned, use mosquito nets. If you have symptoms of dengue, speak to your doctor. Most people recover from dengue fever without any lasting complications. If you have symptoms of dengue fever, you have about a 1 in 20 chance of it worsening to severe dengue. If you have severe dengue and are treated immediately at a hospital or medical facility, you have a greater than 99% chance of recovering.